Welcome back to the Medical Weight Loss Show. I'm your host, Dr. Andrea Walker, family nurse practitioner with my doctorate of nursing practice degree and certified weight loss specialist. Thank you for tuning in today. Before we get started, here's our quick disclaimer. This podcast is for educational purposes only. It should not be considered medical advice or a substitute for professional care. Always consult your licensed healthcare provider before starting or changing any medication or treatment plan. Now, let's get started. Today's topic is Beyond Weight Loss, the full power of GLP-1 medications. We all know that GLP-1 medications like Semaglutide and Tirzepatide have completely changed the game in medical weight loss. But what many people don't realize is that their benefits extend far beyond the number on the scale. These medications have been shown to improve inflammation, hormone balance, cardiovascular health, liver function, and even brain health. So today, I want to take you into a deep dive into some ways GLP-1s are helping patients live longer, stronger, and healthier lives. Let's start out with inflammation and metabolic health. GLP-1 medications don't just suppress appetite, they're powerful anti-inflammatory agents. Chronic inflammation is at the root of so many health issues: insulin resistance, high blood pressure, joint pain, autoimmune diseases, and even accelerated aging. Studies have shown that GLP-1s lower markers of inflammation like C-reactive protein and interleukin-6. When inflammation decreases, the body becomes more efficient at processing glucose, breaking down fat, and restoring hormonal balance. That's why so many patients report improvement in energy, joint stiffness, and even mood once they've been on therapy for a few months. They're not just losing weight, they're lowering their internal inflammation levels, which is foundational to long-term metabolic health. Then there's PCOS and hormonal regulation. For women with polycystic ovarian syndrome, GLP-1s can be life-changing. PCOS is driven by insulin resistance, which leads to hormonal imbalance, weight gain, and irregular cycles. GLP-1 medications help correct this from the root by improving insulin sensitivity. When insulin levels normalize, so do testosterone and estrogen levels, helping restore ovulation and menstrual regularity. Many women with PCOS also experience improved fertility, reduced acne, and fewer carb cravings while on GLP-1 therapy. When combined with resistance training and proper nutrition, these medications can truly help reset the body's hormonal rhythm. And there's also cardiovascular protection. One of the earliest and most significant discoveries about GLP-1 medications is their effect on the heart. They were initially approved for type 2 diabetes because they lower blood glucose, but what really stood out in clinical trials was the cardiovascular benefit. GLP-1s reduced the risk of major heart events like heart attack and stroke by improving endothelial function, reducing blood pressure, and lowering inflammation in the arteries. They also aid in lowering triglycerides and improving LDL to HDL ratios. That's why many cardiologists are now co-prescribing these medications for metabolic patients, even without diabetes, because the data is that strong. If you have a family history of heart disease, these medications may be doing far more for you than helping you lose weight. They may literally be protecting your heart. And testosterone optimization. You don't hear a lot about this, but being that I own a health and wellness practice, I'm very much into this. So, let's talk about how it's overlooked. GLP-1 medications can improve testosterone levels and overall hormonal balance in both men and women. As we know, excess visceral fat contributes to lower testosterone production because fat tissue increases the conversion of testosterone into estrogen. By helping reduce body fat, especially around the midsection, GLP-1 medications can indirectly raise natural testosterone levels. But that's not all. There's emerging research suggesting that GLP-1s may directly support Leydig cell functions in the testes, which are responsible for testosterone production. Some studies show improved total and free testosterone after several months of treatment, especially when paired with lifestyle optimization like resistance training and adequate protein intake. Two things I'm really big on. Higher testosterone means better energy, improved libido, stronger muscle tone, and sharper focus. So while GLP-1s aren't testosterone replacements, they can set the stage for optimal hormonal performance. Now let's transition and talk about cognitive health and brain protection. There's incredible new research linking GLP-1 medications to brain health. These drugs were found to cross the blood-brain barrier and activate GLP-1 receptors in the brain. That's significant because it improves glucose metabolism within the brain, something that tends to decline with age and neurodegenerative disease. In early studies, GLP-1s have shown potential benefits in slowing down the progression of Alzheimer's and Parkinson's disease. They appear to reduce inflammation in the brain, improve synaptic function, and protect neurons from oxidative stress. Even in people with neurological diseases, patients often report better mental clarity, sharper focus, and improved mood while taking GLP-1 medications. And then there's fatty liver improvement. For those with non-alcoholic fatty liver disease, by lowering insulin and triglycerides, GLP-1s help reduce fat deposits in the liver and normalize liver enzymes like ALT and AST. That means better energy, improved metabolism, and less systemic inflammation. For many patients, this is one of the most underrated benefits of these medications. And then there's things like addictions, cravings, and emotional eating. Here's one that surprises a lot of people. GLP-1s affect the brain's reward system, the same part that drives cravings for sugar, alcohol, nicotine, and other substances. Some early studies have shown that patients taking GLP-1s naturally reduce their alcohol intake, eat less processed foods, and feel less reward-driven by comfort eating. This happens because GLP-1 receptors are found in the mesolimbic system, which is the area responsible for dopamine release. So when GLP-1 signaling is active, the brain's response to triggers changes, helping break the cycle of addictive behavior and emotional eating patterns. And then there's longevity and anti-aging. Finally, one of the most exciting areas of GLP-1 research is its potential for longevity and anti-aging benefits. Scientists are now exploring how GLP-1s influence mitochondrial function, oxidative stress, and cellular repair. Early animal models show improved lifespan and reduced age-related inflammation. While it's still too early to call these anti-aging medications, they're certainly part of a larger movement toward metabolic optimization, treating the underlying cause of disease instead of just managing symptoms. Closing thoughts. GLP-1 medications are not just weight loss drugs, they're metabolic healers. From reducing inflammation and protecting the heart to balancing hormones and supporting brain health, these medications represent one of the most powerful advancements in modern medicine. As more research unfolds, we'll continue to learn just how far-reaching their benefits are. But what we already know is that they're transforming lives from the inside out. If you'd like to learn more about GLP-1 medications or see if they're right for you, you can visit Serenity Health Innovations and Wellness in Haines City, Florida, or you can follow us online or even give us a call. You can call us at 863-343-3096. We offer personalized, evidence-based care both in person and virtually, specializing in medical weight loss, hormone optimization, peptide therapy, metabolic health, and online personal training. You can schedule a consultation, learn more about our programs, and even start your journey through telehealth. You can follow me, Dr. Andrea Walker, on Instagram or Facebook for health tips and educational updates and inspiration to help you stay on track with your goals. If you've enjoyed this podcast today, subscribe to the Medical Weight Loss Show so you never miss a new release. Until next time, I'm Dr. Andrea Walker, FNP/DNP, helping you take control of your health from the inside out. Have a wonderful day. Don't forget to meal prep and make sure you get some exercise in.